And what is the relevance of this particular topic? Why we do not want this COVID anymore? Am I right? But it is said in armed forces that more you sweat in peace, less you bleed in war. So it's better to again revise what COVID had done in last 1 to 2 years. So to start with, so initially when the COVID started, it was in the initial few months, it was assumed that the children were less susceptible to the severe SARS-CoV-2 infection, and even though they are affected, they will present with minor respiratory or gastrointestinal problems. So initial consideration was it is a minor clinical problem. However, as the pandemic progressed, there was change in the belief, and it was evident that the children, they can also develop a severe COVID-19 disease. The high-risk group being involved, the severe underlying medical conditions, younger children with so-called multi-system, ground glass appearance, acute diffuse edema. One doctor's child presented with fever on day 1, and then day 2 he was ventilated and he was no more. So such fulminant brain edema were noted in COVID-19 infection during the pandemic. Now I talked about one entity, that is MERS. If you see this is the corpus callosum and this is hyperintensity. So it is said that the splenium of corpus callosum is rich in those ACE receptors, and the child may present with this particular MERS, that is the mild encephalopathy with reversible diffusion restriction on the MRI. Now, EEG findings were absolutely non-specific. CSF analysis, we could not get any RT-PCR positive. The histopathology in the literature was just like Adam-like changes. Now coming to the treatment options, the IVIG, plasmapheresis, methylprednisolone were used just like in any other demyelinating neurological conditions. Antiepileptics must be used for the management of the seizures. Critically ill children, they may require management of the airway and circulation. Now those children who are having underlying muscle disease, like say myasthenia, their treatment was continued same as before the pandemic. Management of the underlying neurological disorders, again there was no change before and after or during the pandemic. Few drugs were definitely contraindicated. So those were the fingolimod and beta cell depleting agents, while glatiramer and dimethyl fumarate, generally we use this in multiple sclerosis, that is the adolescent children. Steroids, IVIG and the plasmapheresis are safe to administer during the pandemic in case of exacerbation of underlying condition. Those who are already on immunosuppressants were continued the same. Drug interactions were noted. So initially they had given chloroquine, hydroxychloroquine for the young adults, and they observed that like any other adverse effect, they prolong acute TC interval, those young patients who were on tricyclic antidepressants. Azithromycin should be used with caution in patients with myasthenia, as it may exacerbate symptoms or cause new onset myasthenia. Now, to end with the presentation, I would like to present my second case. The first we have described the optic neuritis, smog optic neuritis, and this is the second case. Here is the 2-year-old girl who presented with acute onset tremulousness with nystagmoid eye movements. So simple, it was looking like cerebralitis, acute onset cerebralitis. Her MRI brain was normal. CSF showed raised proteins in any other, say, cerebellar conditions. Her viral panel was negative. Autoimmune panel was negative. Her COVID antibodies were strongly positive. So I was sure that, okay, the pandemic is going on. The child is having cerebralitis. There are reports. So treat like, acute cerebralitis, started on methylprednisolone with partial response, not responded, given IVIG, and there was partial response. So even though then the child, after receiving this methylprednisolone as well as IVIG, the child still remained tremulous, and she started developing opsoclonic movements of the eyes, and she was, diagnosed. We did PET scan, and she turned out to be neuroblastoma. So not all patients during the pandemic, which we have thought secondary to COVID, they turn out to be related to the COVID. So what are the outcomes we observed during pandemic? So definitive conclusions about long-term consequences cannot be drawn due to the low number of study cases and time-limited follow-up. ADEM cases have complete resolution. However, a recent meta-analysis found that despite a generally positive neurocognitive outcome, a reduction of IQ, executive functioning, processing speed, learning and memory, and visuospatial skills could persist in up to 43% of these individuals several months after the apparent resolution of the disease. Thank you.